The evolution of facelifts started many decades ago, where patients had a skin incision and the skin was tightened. The problem with this technique is it put undue tension around the scar around the ear and left scars that were unsightly, and the results did not last very long. Soon after that, it was discovered there was a deeper fascial layer, and it's called the SMAS, S-M-A-S. And it was discovered that if you raised the SMAS and elevated that and fixed it to deeper tissues, that would release and remove the tension on the skin closure and would provide much improved scars and longer lasting results. This was the gold standard for many years until recently the evolution has changed and progressed even further, where now the deeper retaining ligaments in the face have been identified, and those are check ligaments that prevent the midface and the soft tissues of the face from gliding appropriately. So now that we know where these ligaments are, we have the ability to go in a deep plane underneath the SMAS structure, release these ligaments, and that now allows all the soft tissue of the neck, jawline, face, and upper third of the face to glide and soften the nasolabial fold and reposition things and fix them in a more permanent area that will allow for longer lasting results and allow for better surgical correction that a more standard skin facelift or just a SMAS lift alone was not capable of doing. The difference between a deep plane facelift and a more traditional SMAS facelift is simply the plane that you're operating in. So the first SMAS lifts that were performed simply just grabbed this deeper fascial layer and lifted and supported it. The problem with that technique is it's not releasing the retaining ligaments, and thus the soft tissues of the face did not glide as adequately as when you do a deep plane facelift. So now with the deeper plane facelift, we're able to go in and release these structures, allow all the soft tissue to glide, and we're able to fix them in a position that's more youthful and that also has longer lasting results. The benefits of a deep plane facelift are simply that the retaining ligaments that prevent the soft tissues from gliding are released. And now you can have a more powerful lift of the midface, more powerful sharpening of the jawline and neck, and you can have more permanent, longer lasting results. Who are good candidates for a facelift? We have patients that are young and that are old, and also patients that have lost weight that results in either excess fat or skin in the neck and an ill-defined jawline. So we get younger patients that want a sculpted jawline, and we get older aging patients that have skin laxity that want that improved. All those patients are good candidates if you take your fingers like this and it improves your jawline and you want better sculpting of the neck, jawline, and middle of the face. The downtime of a deep plane facelift typically ranges from 1 to 3 weeks initially for the swelling and then 3 months for the final pictures. So the first week's a little bit busy when there's sutures that are being removed and there's swelling that's resolving. But oftentimes after a week or two with makeup on, patients are very acceptable. That being said, there's still some numbness and swelling that persists until about 3 months, and that's when we take the final picture. So why should you choose us to do a deep plane facelift? First, it has to do with the background and training, where I've trained at Columbia, Vanderbilt, and Harvard. And then for the past 25 years, we've been doing facelifts under local anesthetic in the office, where it eliminates the need for narcotics and allows patients to recover without nausea and vomiting. We also offer IV sedation and general anesthesia as well. But it basically comes down to the experience and expertise of the plastic surgeon and how many they do per year. And you can also look at the gallery and look at before and afters and read reviews on the plastic surgeon to see if that's really something that they specialize in.